My name is Dr. Babak Azizzadeh. I'm a facial plastic surgeon practicing in Beverly Hills, California. Well, I was always interested in head and neck anatomy and the art and science, the melding of the two was just amazing. And as a result, facial plastic and reconstructive surgery was just the perfect ideal specialty, and I always wanted to subspecialize and be focused in one area of the body, and again, the specialty allowed me to really hone in my skills on one particular area, and it's worked out amazingly well. So about in 2007, we published our first book, Master Techniques in Facial Rejuvenation, which was a multi-specialty, multinational book, bringing together really the top experts in facial rejuvenation to talk about their techniques. And it was a very fresh perspective because most textbooks were either single author books or books that had multiple authors and not really honed in on any one particular topic. So we decided to put together a book that bring in multiple different authors from different specialties to talk about their techniques. So not just have one chapter on facelift techniques, have 5 chapters on facelift techniques, different types of facelift techniques. And we really, again, we were ahead of the curve. We talked about volume restoration, fat grafting, implants, a multitude of different ways of addressing the aging face. And that book ended up being, I think, a very, very, very well received textbook in all different specialties, and has done very, very well. On the same path, we really decided that the same type of textbook did not exist in the rhinoplasty arena, and rhinoplasty has changed but has stayed the same as well. It's a kind of an old school operation with some new flares. So what we did is this year in 2011 we published Master Techniques in Rhinoplasty, and again with the same concept of bringing in plastic surgeons and facial plastic surgeons who are experts, who know these operations and know the way that they think they get the best results. So multiple chapters on not just analysis, not just anatomy, but multiple different techniques addressing the same problem. So we were able to really bring together what I would consider the top 50 rhinoplasty experts from around the world to talk about their way of addressing the nose. Today, what I would consider aesthetic and reconstructive medicine and surgery consists of 4 core specialties: plastic surgery, facial plastic surgery, oculoplastic surgery, and dermatology. And traditionally, everyone's been very closed to really working with other specialties, and plastic surgeons, usually, publish books with plastic surgeons, facial plastic surgeons with facial plastic surgeons, etc. So over the past 5 years, and I think moving into the future, the specialties will need to come together, and that was one of the real thrust of both Master Techniques in Facial Rejuvenation as well as Master Techniques in Rhinoplasty, to really bring together the specialties, because we can learn from each other and really advance the field, advance the art and science of these procedures into the next decade. In addition, I think for resident training or young surgeons or even experienced surgeons, I would love to see what my colleagues are doing, not just at meetings where you really kind of go and hear a 7-minute lecture, but really see in videos, in beautiful illustrations, photographs, and text what they're doing and how they think about these their various specialties, and really look at the masters, the people who have been doing this for a long time and have been the best in the field. So as a result, I think these two books will really be able to allow, again, all types of specialties and all type of experience level surgeons to be able to improve their skill sets and really get better outcome. And at the end of the day, patient outcome is the most important thing. So we want to put forth a textbook that allows surgeons to get better outcomes.